If you have heel pain that just doesn't want to get better, and it's been bothering you for a long time, and it's worse when you take your first step in the morning, or if you've been sitting for a while and you stand up and your heel really hurts, you could have something called plantar fasciitis. Plantar fasciitis usually happens to people who have been standing on their feet for a long time, people who have tight heel cords, individuals who are overweight or who have high arches or overpronate when they run. What happens is this causes some tearing in what's called the plantar fascia. The plantar fascia is this little bit of fascia, this cord that provides the arch of your feet. And what happens is the arch of your feet and the Achilles tendon, as well as the heel cord and the calf, they're your shock absorber. So if you're on your feet a lot and these are tight, then you're going to end up with some micro tears in both the plantar fascia and the calf. And so when this happens, you're going to have pain when you take your first step, because when you're sleeping, the muscles tighten up and you'll have pain with your first step. When you have plantar fasciitis, what you don't want to do is go barefooted. When you're barefooted, you end up having a lot of pain right at the heel, because that's where the tears occur with those first few steps. One of the things you can do when you're having a lot of pain in your heel from the plantar fasciitis is to roll your foot on one of these frozen water bottles. Just take a water bottle, put it in the freezer, and step on it. Heel stretches with the towel like this can really make a big difference. Before you get out of bed, grab a towel and stretch. Hold that stretch for about 20 seconds and do that 4 times before you step out of bed. Grab your toe and stretch your foot. That can help. And then right when you stand up out of bed, lean against a wall. If you hold your hands against the wall about eyes distance, lock that back heel and then bend your knee. That'll help stretch out that heel cord. These sorts of exercises can really make a big difference. Sometimes using a heel pad can help to lift your heel a little bit. Rolling a ball to stretch out the plantar fascia can help. And then for people who just don't get better, you can use these braces. You wear them at night. There's a variety of different types. And basically what it does is when you're sleeping, it holds your heel up, and that way your heel cord doesn't get so tight. And when you take those first few steps in the morning, you don't have those small micro tears happening. So if you've got persistent heel pain that just doesn't want to get better, it may be this plantar fasciitis. So do some of these stretches and it may really get you through it. That's a Minute for Health.